name is Brooke, and today I put together for you a PowerPoint presentation on an informative speech about strokes. When you hear the word stroke, what comes to mind? Age? Gender? Does it really affect me? Knowledge of stroke became known in the mid-1600s, and since then they have done tons of research and put together a bunch of medication and treatments for strokes. Stroke is the fifth leading cause of death in the United States, roughly affecting 800,000 people in the U.S. each year become a victim of a stroke, which ends up killing 140,000 people, which is 120 people. 1 out of 20 people actually die. Today I'm going to discuss the different types of stroke, signs and symptoms, treatment options, why reaction time is so important, and contributing factors. Contributing factors, myself included, along with many other people, have poor lifestyle habits, which causes us to be a potential victim. We get so caught up in our daily life and our daily routine, and we don't always think about the best choices for our body. So maybe this will help us open our eyes a little bit. We don't ever think, I'm going to be a victim of stroke. You never think that it's going to happen to you. According to the website on www.stroke.org, a stroke can be caused by poor diet, lack of exercise, excessive alcohol use, and tobacco use. And there they are right here. There are two types of stroke, ischemic stroke and hemorrhagic stroke. Here's a picture on this PowerPoint showing the difference between the two. This is the more popular stroke. That's 87% of all stroke victims are stroke victim of an ischemic stroke, which is where the blood clot, there's a blood clot in the brain that blocks off blood supply, nutrients, and oxygen to that part of the brain. And it's blocked with fat and cholesterol, which means the brain cells are being depleted of their oxygen. With a hemorrhagic stroke is the other 13% of strokes. It's not as common as the ischemic stroke, which blood vessel weakens and ruptures. Now that we have familiarized ourselves with the two types of strokes, we're going to move on to the signs and symptoms of a stroke and what to look for. There are many warning signs of a stroke, and the word fast can help you remember them fast in an emergency situation. Face, arms, speech, and time. And here is also fast. The face, you want to look for droopiness. If a person is looking at you or when they're smiling, one side of their mouth may not go up. And arms, are your arms numb or weak? Do you feel tingling? If the person raises them up, one might be down farther than the other, and also their grip strength may not be as firm on each side. Difficulty speaking, slurred speech, also talking and forgetting their words or being hesitant about getting out what they're trying to say, registering it with your brain. And most importantly is time. If you witness these signs or experience them, to immediately call 911. Other signs I have not yet mentioned are severe onset headache, onset confusion, trouble seeing in both eyes, and trouble walking. When signs and symptoms start to occur, be sure to immediately write down the time everything starts, what takes place as far as their walking or their talking or their confusion and different things like that. It is very important for the doctors to be to know everything in detail what happened. That way they know how to treat this stroke. Problems caused by a stroke cannot be cured. However, with treatment, they can eventually regain as far as walking in their arms and different things and using them and stuff. Now that we have reviewed the different signs and symptoms and what to look for in the word FAST, it is important to immediately respond and call 911. Now we're going to talk about the treatments and medications that help after a stroke has occurred. Right here is the treatments and medications, some of them. Anticoagulants and antiplatelet medications, which can be administered and can help prevent a future stroke from occurring. Surgery to remove the plaque and buildup in that vein to allow blood flow back into that area that it was restricted. This medication IV, which within the first 3 hours of a stroke happening, that patient can be given that medication and it can dissolve that clot, which can allow nutrients and oxygen and blood flow back up into that area of the brain, so the person has less trauma. And I encourage all of you to read over and familiarize yourself and your loved ones with these signs and symptoms, because you never know when an emergency situation could occur. So the important key points that we went over today are lifestyle habits, maybe to be more aware of what we're putting into our bodies in our everyday lifestyle. Signs and symptoms, what to look for in an immediate situation. And FAST, 4 things to do quickly to see if someone has maybe suffered a stroke. And treatments and medications that can be given, and why it's so important to write everything down, to let the doctor know exactly the time and everything so they know how to treat the stroke. A fact from the American Heart Association is that women are more likely to suffer a stroke than men. And I hope that my informative speech has helped you guys gain the knowledge to have if you're ever in an emergency situation, and that you will have the understanding and the knowledge to react immediately and help, whether it's you or a family member or a stranger. Thank you.